Hey, my name is Luke Schellenberger. I'm an ENT doc. Patients oftentimes complain about ear pain, or they come in and saying, I've had an ear infection. It's been there for months. And most of the time, we look in the ears and we say, you don't have an ear infection. So what's going on? By far the most common reason why patients have ear pain, especially adults, is actually referred pain from the teeth or from the jaw, even sometimes from pain around the back of the neck related to cervical spine problems. It's not always the most common reason, but it's a very common cause of longer term, weeks or months of pain. Easy way to tell is if your jaw is real tender, or if you notice it more in the morning, that's oftentimes a sign that you've been grinding your teeth that night and you're putting a lot of load on that jaw. So what's the first thing to do? I would say stop chewing gum, chewing tough things, chewing your nails, stay away from real tough foods. Second, if you are noticing or somebody says you're grinding your teeth, then go see a dentist and get a little dental guard. Or you can get one online. They're cheaper online, but they're bulkier and sometimes harder to use. Dentists make really nice ones, but they can sometimes be a little bit pricey. Over-the-counter medications like anti-inflammatories are not a bad idea. I'm not a huge fan of ibuprofen because you have to use a whole lot of it. Patients usually aren't comfortable taking like 4 tablets 3 times a day. I like Aleve a little bit better. It's important to understand these medications have a pain effect where they reduce pain, but that's really not what we're trying to use them for. We're using for their anti-inflammatory effect, which does take longer periods of time. So a lot of times patients will say, I took an ibuprofen or took some ibuprofen, it didn't work. Well, you have to use it. And so a lot of times I recommend patients use Aleve or a prescription anti-inflammatory for even 3 or 4 weeks at a time. Topical medications like diclofenac or Voltaren, you can rub right around the jaw joint. It's not a bad idea. Applying pressure or like warmth, heat, or ice. I don't know why the extremes in temperature seem to be helpful for reducing pain. And then also, of course, you want to stay away from tough foods. Stick with softer foods, but easily the biggest steps is really just taking away a lot of load on the jaw. So if we just stop chewing gum, which a lot of patients come in and they actually say my ear is infected, and I literally say you're chewing gum right now, and they say, oh, I love chewing gum. You're like, that's your problem, all right?